Well, one thing I would say, the collegiality between the doctors and the nurses is much greater. When I first started, the doctors were much far removed, and there was a great deal of distance. And they didn't really respect nurses' opinions, and the nurse was more of the handmaid. And you would literally, if the doctor came in, you would get up and give them your seat, that sort of thing. Now doctors ask your opinion on things and really take into account what you have to say. They're looking for your insight and information. So I see that as a big change. Technologically, we have grown leaps and bounds. You guys have much more to learn than I had to learn when I went to school. Your textbooks are much bigger. Even the labs, the lab books. And of course, pharmacology, they have probably, I'm sure, at least 5 times, maybe 10 times more drugs than what I had to learn. So everything is magnified over and over again. And it's good, we did not have open heart surgery, of course, when I was, that maybe it was in the 70s, maybe the very late 60s, they had that. Now it's commonplace. But to replace that, they do the cardiac casts, they do the little roto-rooters, they do the balloon procedures, and they can save you from having to have open heart surgery. So things of that nature are an example of what we can do. Kidney stones, they can don't have to do surgery for that, to remove them. There are just so many different technological advances. And I think the big thing is the in and out. When I started out in my practice, we would have probably the same number of patients, maybe more than you would have, and maybe have a wing and somebody else would have the other wing on the floor, and maybe we'd share an aide, or maybe have an aide to help us. But half the patients were in there for their annual physical. They'd get their barium enema, their EKG, that sort of thing. So they were up and walking and talking, and they required almost no care. You'd give them a back rub, pass their medicines, that sort of thing. And the other patients could be as sick as the ones are today, but they were just half of them. So now we wouldn't consider admitting a patient for a physical. They're done in the doctor's office or as an outpatient. You have your colonoscopy, which we didn't have then anyway, but certainly the upper GIs and the lower GIs we had. But you were admitted to have them. And so we'd be giving enemas. Now the patient does it at home.